The first one was written by Dr. Kamara Jones, who's in the room, and who was the president of APHA with the idea for this project, is my understanding. The other forward, and that forward provides a sense of APHA's view and Dr. Jones's view of why this is important. The other forward is called The Long Trajectory. And it starts, well, let me just say this. The way that it starts is tamped down sufficiently from how Dr. Jenkins wanted it to start. Race is a figment of the imagination. Racism, on the other hand, is real. The problem in America is not that people look different from each other. The problem is that people are treated differently because of how they look. Racism is a pervasive force that produces differences in health and socioeconomic status. Yet, historically, the field has focused on race rather than on addressing racism. This has helped to reify the notion of race and obscure the underlying role of racism in producing the patterns of health inequities that persist in our society. So, as I recall, he had quite colorful words for the nature of racism in society and also for the ways in which racism continues to work within our field. So the book is structured in essentially units. The first unit asks, is racism a public health issue? And there we lay out reasons why we believe, contributors, various authors lay out reasons why we believe it is a public health issue. One of the chapters there actually offers generously, I believe, an illustration of the ways in which racism operates even within the schools of public health that train our future public health professionals. That chapter by Dr. Ariamua and Wellamore. And it's asking for those who are in positions of power to use that power to learn from the experiences of faculty of color and therefore model equity in our training for students. The next unit is on how does racism affect health. And so we structure that part in terms of focusing on the structural mechanisms, the interpersonal mechanisms, and then how do we talk about these mechanisms. And we draw on Kamara's actions and allegories. And we're really delighted that in this section, we not only reprint those actions and allegories, a number of them, but she offers her reflections on how her thinking has changed since the original publication. What do we do about racism? And that's the place that people want to go to quickly. The challenge for us is really how do we do that in an evidence-based way? And there are a number of examples, for instance, thinking about addressing racism in the healthcare system, the anti-racism models of the Greensboro Collective, trying to increase scientific literacy, working with white allies and white people to be more effective allies. Are there group-specific experiences? That's unit 4. And here what was important for us is not just hearing the term racism and thinking black people in the South and whites, but rather thinking about the ways in which racism affects the experiences of, for instance, Native Hawaiians, Asian Americans, and various racialized religious minorities. In the final unit, we just ask, where do we go from here as a field? There, Brian Smedley, who many of you know, offers some remarks to guide us. The book also includes a number of appendices that include instruments, measures, etc., so that community members and public health professionals working on the front lines can use these tools and use concrete tools in real practical ways. So that is the book in a nutshell. I mention it in part because we sold out of it yesterday. So you might not get to see that firsthand. But thank you for the opportunity to say something about this project. And I guess
So this final discussion is actually from this final discussion is from the chapter that was co-authored primarily by Bill and Vic, and they were kind enough to allow Chandra a little snippet contribution. And first, I want to make sure that you understand that there are no relationships to this, financial relationships or commercial interests relevant to this presentation. Sankofa, many of you know, is an Adinkra visual symbol. Learn from the past, build from the past, and there must be movement from the past. But as we move forward in March, I can't read this anyway. The idea is that we revisit the past to learn how to move forward into the future. So that was sort of the idea of some of the thinking in what is presented in this chapter. It's an example of reaching back to the past to support movement into the future. And in writing this chapter, the author reported to have two goals: to help public health professionals see the current efforts as part of a long history, and to provide examples from the past that might be useful in moving forward. The chapter provides a snapshot of how public health has responded to racism. Public health advocates have known of and fought against the health implications of racism for decades, but it's only in the past couple of decades that the term racism has been used openly, even though the efforts to overcome the impact have been ongoing. This chapter focuses on African Americans. However, we hope these lessons can influence strategies that public health professionals can use to advance the rights of all ethnic communities to attain health equity. I obviously can't include the entire chapter in this presentation, and I only provide a broad sweep of some of the history. And I decided to focus primarily on public health response to the civil rights movement and highlight the evolution of anti-racism work that began in the last decade of the 20th century. I encourage you to read the chapter to find more about the little-known history of groups like the Association of Black Cardiologists, the National Black Leadership on Cancer, and the University of North Carolina at Chapel Hill School of Public Health Black Minority Student Caucus. Each of these is an example of confronting racism in public health. So let's start with the Civil Rights Movement, which inspired initiatives to improve the health of the Black community and to reduce segregation in American medical institutions. For example, the Mississippi Freedom Summer of 1964 led to the genesis of the Medical Committee for Human Rights, which became the medical arm of the Civil Rights Movement. The Great Society was a set of domestic programs that grew out of the Civil Rights Movement, and they were directed by President Lyndon B. Johnson from 1964 to 65, in response to the movement. The main goal was the total elimination of poverty and racial injustice. I'm glad we got that. Wonderful that we did that. In addition to the passage of the Civil Rights Act of 1964 and the Voting Rights Act of 1965, Johnson pushed through the Economic Opportunity Act of 1964, which was created to oversee a variety of community-based anti-poverty programs. H. Jack Geiger was one of the Medical Committee for Human Rights physicians who successfully worked to apply President Johnson's Great Society program to public health. Geiger and Count Gibson, then chair of the Department of Preventive Medicine at Tufts in Boston, obtained a $300,000 grant from the Office of Economic Opportunity to establish a community health center at the Columbia Point Public Housing Project in Boston, and, quote, a southern rural health center. The original proposal did not specify the location for the second center in order to avoid the director of OEO, Sergeant Schreiber, from having it reviewed and rejected by the Southern Congressional delegation. The Dorchester Community Point Health Center, now known as the Geiger-Gibson Community Health Center, became the first operating community health center in the nation when it opened in 1965. Based on the South African model of community-oriented primary care, Dr. Geiger's vision sought to confront abject poverty and medical disenfranchisement. He believed a health center would not only provide much-needed medical relief and social services, but also a path toward community empowerment and direct citizen action. People would lift themselves up and their families out of poverty and bring their neighbors with them. With the prospect of OEO financial support, Geiger and Gibson searched for a location for a site in rural Mississippi. Their campaign required circumventing strenuous opposition from Mississippi political leaders and its white medical establishment, as well as diffusing suspicion within the black community. John Wesley Hatch, an African-American activist, did much of their original outreach and scouting in the Delta. Geiger had hired Hatch, a social worker and community organizer with the Boston Housing Authority, who had been appointed to the Tufts faculty to help develop the Columbia Point Health Center. Hatch arrived in the Mississippi Delta in the fall of 1965 and spent several months getting to know the community, including working in the cotton fields. Hatch affirmed the choice of Mount Bayou and developed critical lines of communication within the community. Schreiber approved Mount Bayou, Mississippi site only after Geiger and a Tufts vice president engaged in a sit-in at OEO. In this way, Geiger and Hatch together established the Tufts Delta Health Center, the first federally funded community health center in a rural community. Examples of other community initiatives during this period included the 1969 unionization of black hospital workers in Charleston, South Carolina, the Black Panther Party's free health clinics, which was announced in 1968, and a free breakfast program to improve the nutrition of black children. And then in 1970, the Howard University Mississippi Project, which made a valiant attempt but unsuccessful effort to develop a center in Marks, Mississippi. Although civil rights demonstrations embraced nonviolence, arrests and violent acts eventually led to violent responses in early 1963. Most of the disturbances from 63 to 64 took place in the South, but outbreaks also occurred in Detroit, Chicago, Cleveland, Philly, New York City, and 3 New Jersey communities. In 1965, the Watts neighborhood in Los Angeles erupted in a 5-day riot, leading the police chief to request assistance from the National Guard. Turmoil continued during 1966 and 67. A series of riots occurs in major cities, leading President Johnson to create the National Advisory Commission on Civil Disorders, headed by Ohio Governor Ronald Reagan. The current commission report, issued in '68, identified white racism as a major cause of the riots and called for new jobs, new housing, integration of housing, law enforcement, and occupations. The report did not mince words as indicated in this quote. Discrimination and segregation have long permeated much of American life. They now threaten the future of every American. The report was penetrating in its analysis, prescient, in its predictions, eloquently crafted and essentially ignored by President Johnson. An article in the Smithsonian Magazine summarized the outcome of its title. The 1968 Coroner Commission got it right, but nobody listened. On the national level, the specific needs of blacks were of little interest to most public